could be,
Could
but nobody, oh, I won't say nobody, but rarely would anyone go to any one of those 4 offices. That's just where the teams are dispatched from.
Well, I know, but I mean, it's the presence. The
Well,
biggest
okay.
problem I think we've had, or what I've seen tonight is just the communication pieces. I mean, the health department knows it, and I don't know if commissioners need to know, but evidently the, just communication. Mr. Gooden,
I'm gonna pass this time.
hallelujah.
You ain't never pass on yours every time
Mr. Webb.
I have one question though. If you already have somebody in your network that's doing a great job for Eastpointe, if they chose to take their funds and go brick and mortar here, and they're providing a good service for y'all, and they meet your criteria and you're happy with the results that they're providing, would you agree to allow them to build bricks and mortar here visually? And I think that would satisfy a lot of minds. Would you allow that?
That's a very good point.
Thank you so much.
Okay, my next question, this is the last. Okay, I'm gonna sum it up. Going forward, what can Eastpointe do, or what does Eastpointe have, and you might not have to ask, you might have to come back again, that's just a question, but going forward, what plans do Eastpointe have, and I wanna put Cardinal in there because everything's been talking about, and I know they're not here, so it's probably not fair to ask you that, but what plans, going forward, does Eastpointe and Cardinal have for Bladen County? And I can delay it if you don't have the answer.
I think I will write your question down, and then as we're done, I will coordinate with Cardinal and we'll communicate that.
And I'll share it at the next board meeting, because that is a concern. Thank you, ladies, thank you, mental health, thank you. Thank you for bearing with us.
This is a good educational thing.
Thank you.
Yeah, that was good stuff.
Matters of interest, Commissioner, anybody have anything?
Yes, I want to say, last meeting I was remiss. We went to, Mr. Brick and I went to the EMS session out on 701, and we talked to Bradley and 2 of the sheriff's officers. And we had a chance to just look at facilities, what work they've done, and I want to commend them for the work that they've done, as well as the volunteers that have participated. And I want to thank Bradley and the sheriff for their work. Good work. Thank you.
Okay, next item is individual delegation wish to address the commissioners. Do we have anyone?
Yes, sir.
All right, come forward, Mr. Belvin. You got the floor, sir.
I'd like to thank the commissioners, chairman, for this opportunity to speak. I spoke several months ago, and I was very brief. I have a whole lot to say, and I'm going to try to be as brief as possible tonight. I covered, the last time I was here, I covered the 2008 arrest. I would like to cover the October 14th, 2014 arrest. I apologize, I wasn't prepared for tonight. I have folders that I will finish up putting together, so I want to give each one of the commissioners, and it's kind of a summary of my career. Commendations, again. The purpose of this is kind of going to be an info overload, but the purpose that I'm trying to accomplish is that in my past, since 2005 and basically 2008 during my first arrest, there is 2 distinct different Donald Lee Melvin seniors. There's one that my career and the thousands of people that were my customers and friends who know me know that I am a God-fearing man who has not laid a hand on anyone. I'm not dangerous in any way. And then there's the way I've been portrayed by the Bladen County Sheriff's Department and a few neighbors and some few family. There's 2 distinct for trails there.
Mr. Melvin, get to the point.
Okay, I am,
And
okay,
do not mention
okay,
their name.
okay, okay,
Okay, thank you.
okay. All right, on October 2014, I was driving trucks cross-country for SRT, Southern Refrigerated Transport. I had been on the road for 47 straight days. I had earned 7 days off. I pulled into my farm, parked on my road, and immediately to Bladen County Sheriff's Department. I was inside the home of a lady who is kind of my adopted mom. There again, I'm not going to call names. I was inside her double wide. One sheriff deputy came to the door. There was another one with him, backing him up. He came to the door. I would not go to the door because this arrest, I can prove, as a lot of different things. It was political. Even though I was just come from California, I was promoting the opposition to the sheriff that was then in office because of unlawful arrest that he had done against me. So I was promoting through Facebook, hammering Facebook, and I have about 3,800 followers. I was hammering Facebook, supporting the opposition of the sheriff that was in office at that time. So, to make a long story short, she came back and told me they want me to move my truck. I said, you tell them that truck's on my road, I'm not going to move my truck. It went back and forth. But finally, she went going back and forth. But I said, you tell them if they'll leave, I'll move my truck. She went back outside. She was gone for 15, 20 minutes. I assumed that they had left. She had told me, it was October 14, 2014, deer season was the next day. I'd been on the road for 47 straight days, gone for like 3 months, orientation, driver training, all that kind of stuff. I just wanted to go sit in my tree stand with my son and daughter's 22 bolt-action rifle with a scope and my daddy's Smith & Wesson 30-06 handgun. She had told me I could drive her truck to the top of the hill and park it, walk down there. It was about 2 or 3 o'clock in the afternoon. I never got that chance. I assumed that they had left. I walked out her back door, walked around the front of her truck with my dad's handgun, pointed at the ground. She's the eyewitness. She told them, she told my sister, Bladen Key, a real estate agent, broker with Market Road Realty. She told everybody. I did not look at the deputy. I did not point a gun. I did nothing against the law. Whenever he saw me, he opened his car door and drew down, and the only reason why he didn't shoot me because she was standing in between me and him. I ran back in the trailer, laid the handgun on the couch where, because I wasn't going to walk out with both of them because both of them was loaded. I laid it on the couch. I went and sat in the bathroom. It was about 30 minutes later, the whole field out there was full of Bladen County Sheriff's deputy, and they sent the SWAT team after me. Why? I don't know. Because they already took the guns outside. But again, so I spent 178 days in solitary confinement. I was sent back to Raleigh for all this mental evaluation BS. And then, to prove my story that that's my road, something happened just recently that y'all really need to know about. Just about a week. Sir, this is my life. My life's been ruined. This is my life, sir. My life's been ruined.
I tell you what, this is court order, you take it up in the district court. You throw it.
Okay, thank you for your time.
You're welcome. Finance Department? Oh, I'm sorry. One more individual, Charlotte.
I'll be quick, and I'll try to make it real easy. After hearing from Eastpointe and our mental health providers, I did have a few questions. According to Eastpointe's Gaps and Needs report that they supplied for 2016, according to what they have, there are 64% adults and 62% of children are underserved for their area. So that what I'm seeing here is over 50% of people needing services are not getting the services that they need. that's an issue. To me, it's important. There are so many different services and providers in the different areas. How is any one citizen or any citizen supposed to know which provider offers which service? Well, the answer is they need to call the 800 number to Eastpointe. So wouldn't the easiest thing to do would be Eastpointe to advertise their number that everybody needs to call? So instead of the providers advertising, why isn't Eastpointe advertising that number that everybody needs to call? That way, they can direct them to the right provider that offers the service that individual needs, because someone may need substance abuse, the other one may need intellectual development disability services, which is 90%. A child with IDD is 90% underfunded, or underserved in North Carolina. And then why are program reviews so low? They said that they did 10 program integrity reviews last year. Why is that so low? That's one of their main functions as a managing entity. Why are they not reviewing more providers? That's it.
Thank you, ma'am.
Thank you.
Ms. Lisa?
Thank you. Did you get each of you?
I'll make this real short. I'm gonna go over the dashboard reviews for the month ending April of 2017, it's for the 10 months. At the end of April, we have received 88% of the revenues budgeted and spent 79%. On the jail, we completed 80% of the construction and paid those bills. Solid waste, we have received 98% and spent 75%. Emergency telephone, we have collected 68% and spent 80%. And water, we collected 86% and spent 48%. So just to let you know on that, the bond payment is due the first day of June. So that will be coming due. Any questions on that one? Thank you.
Thank you.
Thank you. Health and Human Service, Mr. David Howard.
Item A, change order for Youngstown Connect. So what you're looking at here is a required change order for the contract that's approved by you as Commissioners of Board of Health. And I will apologize, the letter you have in your packet dated May 3rd, the first line of the second paragraph, that last phrase, to continue providing transportation, is not correct. What we're doing is simply adding $5,000 to child care services and pulling $5,000 from transportation. So we're doing a flip-flop there. We don't need as much money in transportation, and we're moving it to child care. But since these are contracts with these two organizations providing services, we need your approval to do that.
So we don't,
Is there a motion? Motion by Mr. Good and second by Mr. Perry. Any discussion?
there's one question, is this the same one that we say that's on that contract arrangement that's, this revolves every year, same people?
Right, we update them every year, every July,
The
as the
same
grant
person,
renews.
we don't RFP or anything out there, we don't do anything like that.
We did that last summer, if you'll remember, in 2016. And we normally do that every summer.
Okay.
That's what,
Yes,
do you
ma'am.
advertise or do you put a notice out?
Well, we put it out, truth be known, there's only limited services that are available to provide the hours, for instance, for child care that are needed for the after-hours programming that we do. But yeah, we bid it out and give everybody the opportunity to bid on it.
All in favor, say aye. Aye. All opposed? Item B, guard animal shelter.
So I provided something, Craig, did this get into their packet? I don't think it did. So the parvo in the animal shelter, parvo is a viral illness. It affects animals such as dogs. Doesn't affect humans. Humans are able to fight it off. We had the week of May 1st, Parvo was originally introduced to the shelter by 4 dogs that animal control officers picked up. These are dogs who were owned by someone, but not necessarily taken good care of, and obviously not vaccinated when they're puppies, as normally happens. What's believed happened is at least one of these dogs had Parvo, brought it into the shelter, spread it to a couple other dogs. And a lot of times, we're fortunate in that we transfer a lot of animals to shelter, to rescue operations. These 4 dogs were given to a rescue organization, and after they received them, after a day or two, they let the animal shelter know that they were showing signs of illness. And that tipped us off that at least 1 or 2 of them had Parvo. We began observing and examining the animals in the shelter, and began immediately trying to clean the shelter spaces and to prevent any further spread. We did observe some animals in the shelter who were showing the symptoms. Symptoms are diarrhea, vomiting, and basically which ends up in dehydration, which is usually, those are the symptoms that will cause a dog to pass away. Week of May 8th, 1 dog tested positive for Parvo, and what happens is if the dog is so ill that it's not going to recover, it's up to us to euthanize the dog. So we had to do that for that first dog. Tuesday of that week, another dog tested positive for Parvo, and that dog had to be euthanized as well. During this time, we were cleaning the shelter. Now, of course, Dr. Hanby is our vet of record, so we contacted her to see what we should do. She made her recommendations as far as closing the shelter for 7 days, not accepting any more animals because accepting them, and most importantly, not adopting out animals that could have the Parvo illness, and then we're putting that cost on the adopter. Normally, just to let you know, our process is to vaccinate all animals that come into the shelter immediately for Parvo and other vaccinations, or at least give them a booster, just because a lot of times we don't have any records. So that's normally done, and so Tuesday, we got the order to close for 7 days. Wednesday, we completed giving all the dogs Parvo vaccination that were able to receive one, and then Thursday, we completed the sanitation of the shelter. Friday, the 1 dog, and I just got an update this afternoon from Karen over at the shelter. The 1 dog on Friday who had diarrhea and with some blood in the feces was tested, boosted for Parvo, but then tested negative for Parvo. So it's believed that the dog just needs a parasite treatment. And a lot of times what happens is we don't have the funding to do medical treatment for these animals, so the rescue organizations, if they have funding, will turn the dogs or the animals over to the rescue organization. They'll use their funds to pay for some medical treatment for that. And that's what we've done with that animal. So it doesn't have Parvo, but it's still done. I included some take-home messages because this is the most important thing for us. Getting animals immunized as early as possible is the most important thing. Whether you've got, dogs that are going to be outside dogs, inside dogs. If all these animals have received vaccination, which is usually pretty cheap and easy, this kind of thing doesn't happen. Now, Parvo does exist in the wild, so that's why we do vaccination. And we'd like to send that message loud and clear to the public to get your dogs vaccinated, and basically include that consideration into the cost of ownership, just like anything else. Any questions about that? We still plan to open back up on the 17th this week. It looks pretty good. We don't have any new cases this week. And like I said, the shelter's been sanitized, and we'll try to make sure this doesn't happen again anytime soon.
Is it possible for coyotes to get Parvo?
Can the coyotes get Parvo? I would expect so, yeah. Opinion.
Okay, thank you, sir. Item 7, advisory board of Bay Tree Lake. 1.
Mr. Hemingway?
Motion by Mr. Good, second by Mr. Cardell. Any discussion? All in favor, say aye.
Aye.
The Bladenburg Fire District, motion by Mr. Dow, second by
Second.
None goings. Any discussion? All in favor, say aye.
Aye.
Dublin Fire District, reappoint Mr. Dow, second by Mr. Rowland. Any discussion? All in favor, say aye.
Aye.
Keep Lane beautiful. I got, Ms. Saunders is the chair lady of that, and she wants to replace Miss Mary Belton and Natasha Bullock Dillon, and add Miss Billy Hall, Miss Tracy Smith, and Miss Marlena Dean. So what the pleasure of the board?
Motion that those names be accepted.
Okay, motion by Mr. Brooks, second by Ms. Moon. All in favor, say aye. All opposed? Greg, that's up, Greg.
Thank you.
White Lake Planning and Zoning, Mr. Report, second by Mr. Gooden.
Second.
Any discussion? All in favor, say aye.
Aye.
Mr. Martin, calendar update?
Thank you. Mr. Chairman, I'd like to,
Online.
Get on up, we wouldn't get on.
Online. Mike.
I'd like to review the calendar with you Mr. Cottonelle just reminded me you're accustomed to having a hard copy, and I didn't realize that. Maria unfortunately is unable to be here tonight, so. But I will just mention a few things that have been added since our last, meeting. Just remind you that this weekend is the White Lake Water Festival. Offices are scheduled to be closed on the 29th for Memorial Day. Remind you about the webinar related to human services that will be held in Wilmington on the 31st. One thing that's been added is the JCPC luncheon is scheduled for June 1st, which is a Thursday. You all are invited to attend that. Also, I want to let you know we just received in the mail today an invitation to the Southeastern Economic Development Commission annual lunch meeting that they have each year in the spring or in early summer. It will be held on June the 5th, which is a Monday, at 12 noon, and that will be held here in Elizabethtown at the Cape Fear Vineyard and Winery. The board is scheduled to meet that evening on the 5th at 6:30 p.m. There's also a prayer service that morning at 8. The Bladen County Fire Association meeting is scheduled for Thursday, June the 8th at 7 p.m. at the Hickory Grove Fire Department. The board is scheduled to meet on the 19th at 6:30. The Elizabethtown White Lake Area Chamber of Commerce annual banquet will be held on Tuesday the 20th. And then on 3 Thursdays in June, the 1st, the 15th, and the 29th, the Sunset Jams concert series will be held at White Lake, so just remind you about that. Also, Mr. Chairman, while we're on the topic of calendars, one of the items on the agenda is to request that the board schedule a special meeting regarding the budget for next Monday. We initially had conversation about having a meeting on that date related to this human service or mental health services. But that date is suggested for our budget meeting if that works with you all.
The good?
One second on June.
In May.
May, next Monday. Does it go there, Mark?
5:30.
Motion by Mr. Gooden, second by Mr. Cogdell. All in favor, say aye.
State 22nd, 5:30. I had mental health at 4:30.
That's what I'm saying, we already had that date earlier and that changed it until today. Mr. Chairman, the last item I'd like to address is a request from Bladen County. The Board of Education adopted a resolution related to its intent and interest in deeding the property that is at the old school, the school on Martin Luther King Drive, that currently the Bladen Youth Focus Project, Inc. owns a portion of that property. They would like to deed .63 acres, which includes the gymnasium facility, to that organization as well. And at basically a nominal cost, maybe $10, I think is what Dr. Taylor indicated the conversation had been, so it's basically at no cost. As required by statute, the Board of Education is required to offer that property to the county for first right of refusal, and so it's being brought to you at this time.
I'll make a motion that,
.63,
Yes, sir.
I thought it was 6 acres,
No, the total tract is just over 5.
so they're just donating the .63.
Yes, sir, and we have the map here, and we just double check that.
I'll make a motion that we accept it.
Second.
Motion by Mr. Cogdell, second by Mr. Brett. Any discussion? Well, I got something to say. I know it's not gonna be popular, but I'm gonna say it. I I think with the school system in such financial stretch they are, I think we're at a crossroad now where things, time to quit giving things away and getting a little something back so we can help support public education.
You know, I would agree with that, but I think the statute doesn't allow them for education purposes and counties like that, or services. I checked that. That's why they don't charge them. Because of production, that was why.
I don't think the statute covers that youth folks.
Well, it's an option. That's what
It's okay.
Can I say something?
No, ma'am. Any more discussion? All in favor, say aye.
Aye.
All opposed? Ayes have it. Individual delegation wish to address the board? You can speak now if you like.
Ms. Minnie?
Ms. Minnie, you can speak now.
Okay. I just wanted to say that I am the president of Bladen County Youth Focus Project, and that facility is used, that's all we can use it for is education. That's in the deed, we got the first property from the Board of Education. It can only be used for education, and that's what it's for. These children in here use the gym for practice now for AAU basketball.
We hope you enjoy it.
Thank you.
You're welcome.
Consider entering closed session according to NCG 143-318, attorney-client privilege. Second. All in favor, say aye.
You got to call back.
Hit the road, Jack.